So my name is Paul Dixon. I'm a consultant orthopaedic surgeon, so my managerial background is negligible to say the least. Which I guess is why I'm going to talk a lot about patient care and probably gloss over the pathways to a certain extent. In 2007, the BOA, British Orthopaedic Association, and the British Geriatric Society launched a blue book which set out standards of care for hip fracture patients. It recognised that things needed to change, and I think it's very salient today given the headlines on the front of the Times that I've just seen in the foyer. Recognised that this wasn't just about a broken hip, it was about the patient attached to that hip, and the complexity of the fracture was really, to a certain extent, not relevant until you considered the complexity of the patient. And there was a cost, both in human and economic terms, to the NHS, which could be improved. But the real impetus, in terms of focusing things, was the introduction of the best practice tariff in April 2010. So the quality of the care we provide was linked to the income that the trust got. And this was all based on the NHFD data. Each year, the gap between achieving best practice and not achieving in terms of payment, that gap has increased. And each year, the goalposts have got a little bit further away and it's become more difficult to meet those targets. So there's had to be a sustained improvement. Things have improved. Initially, when we started the project, patients were taking 38 hours on average to get to theatre. By 6 months into the project, that was down to 25 hours. And the number of outliers had decreased as well. It's been gradual, with blips in July and August last year, which I can't really explain. It may be something to do with the holiday period, I'm not sure. There is a trend that the length of stay has gradually come down, and it's come down by an average of 5 days, which in monetary terms is huge. And it's also meant that there's less pressure on our elective beds. So we're getting the elective cases through rather than cancelling on the day because there's no beds. Thank you.